my concern is that as everyone is wanting this withdrawal, they're not thinking about those ramifications of how you go about a withdrawal. And it's not just getting us out of the country. It's dealing with the fallout from what these soldiers have seen while they're there. So if you could expound a little bit on the whole healthcare piece of this and how you address when you're bringing 7,000 people out a month,
Right.
how the VA handles that.
Absolutely, because you know what I have said is that the best way to support our troops is to bring them home, and then when they come home, support our troops. You know, support our troops doesn't just mean when they're somewhere else. Support our troops mean when they're back here in New Hampshire and across America. And the fact is that we're not doing a very good job of that. We do not have the health care and the services and the compensation that these soldiers have earned available and accessible to them. So there are a couple of things. Number one, we have to do a better job keeping track of soldiers when they're in active duty status and as they come home, and if they stay in the service, providing what they need, and if they get out of the service, providing what they need, but doing it in a seamless, continuing way. Here's what happens now. And I've been working on this for a couple of years. You know, I'm on the Senate Armed Services Committee. I have one of the big bases in upstate New York, the home of the 10th Mountain Division in Fort Drum, and we have had to deal with a lot of the problems that soldiers and their families have faced. And I was up at Fort Drum last summer talking with about 50 soldiers who'd been wounded in either Iraq or Afghanistan and trying to understand the problems they faced. Their records get lost all the time. Paper records. You know, one soldier said, you know, he'd been wounded in a convoy attack, and you get great medical care on the front lines. The best medical care American soldiers have ever gotten, and it keeps a lot of people alive that would have died in the first Gulf War. So he gets stabilized, and then he's going to be flown to Landstuhl, which is our big military hospital in Germany, which is a great facility. I've been there and seen the superb care that is given. So he's being wheeled out, and somebody says, "Soldier, here are your records," puts a pile of paper records on his belly, says, "Don't lose them." Meanwhile, he's being sedated, remember, because he's got a long flight on a pretty uncomfortable plane to get from Iraq to Germany. So, of course, by the time he gets to Germany, his records are gone. Nobody knows where his records are. So we need electronic medical records, something that will keep track of everybody when you enlist until the end of your life through your active service and your veteran status. We need to fully fund the VA, and the VA has to be prepared to take care of these new, young, returning vets. A lot of them have profound physical injuries, and a lot of them have very difficult brain injuries that we're only beginning to recognize. This came to my attention about 3 years ago when a mom called me from New York, and she said, "I don't know what's wrong with my son. He got back, and he can't remember anything. He has to be constantly told where he's supposed to go and what he's supposed to do. He's been to the VA. They don't know what's wrong with him." And that was the first I heard of what's called traumatic brain injury. And traumatic brain injury is kind of like, shaken baby syndrome. When a baby is shaken and their brain is actually injured, even though there's no physical evidence of that. When you're in one of these convoys or you're near one of these bombs, even if you're not physically injured, it can literally shake your brain. It's a concussive effect inside your head. I was at Walter Reed a few months ago and visiting some of our wounded soldiers, and I ran into a young captain who had been in a convoy attack. He'd lost his right arm, and he'd lost his ring finger on his left hand because his wedding ring had melted into his finger, and they couldn't save it. So I said, "Well, Captain, how you doing?" He goes, I'm making progress. They're great with the prosthetics. They're teaching me how to use it." He said, "I think that will be something I can figure out." And then he said, "But where do I go to get my brain back?" He said, "I went to West Point. I never had anybody have to take care of me before. Every morning now, my wife has to give me a list of where I go and how I get there. So I passed the first legislation to begin to do more work on traumatic brain injury, and we passed some more recently in the defense bill that I and others had worked on to take care of our wounded warriors. But we have a long way to go, and we need more expertise. The VA needs more expertise, and we need to permit soldiers and their families to go outside the VA system to get help as well. So there's a lot that I'm going to try to do. We also have a backlog of disability claims, hundreds of thousands of claims that are not being resolved. And when you read about the really outrageous problems at Walter Reed a few months ago, a lot of it was people were being warehoused because they had come there for medical conditions, but their disability claims had not been resolved, so they couldn't leave because they didn't want to leave the military until they got their disability rating. So they were just left there. And we're just, there was a good study done, a commission by former Senator Dole, who, as you know, is a wounded hero of World War II, lost use of his arm, and Donna Shalala, who was the Secretary of Health and Human Services when Bill was president, and they came out with some excellent recommendations. We've got to implement those. Don't do any good if they're just sitting in a desk somewhere. One of the recommendations is something I've already acted on, along with Senator Chris Dodd, and that was to extend family and medical leave to the families of wounded soldiers so that they would have more time without fear of losing their jobs. Because when you have been injured like that, and you're at Walter Reed or you're at Brooke Army Hospital down in San Antonio, having your family there is so critical. Remember, a lot of these people are 19, 20, 21, 22 years old. A lot of them have never been away from home before they joined the military and went off to Iraq or Afghanistan. So they need family, they need that support system. So I am committed to doing everything I can. It's really one of the highest priorities for my presidency, because I think if somebody signs up to serve our country, we should sign up to serve them. And I intend to do that for as long as I can.